observing your class.
Oh, yeah, you did already, right?
Did
you observe it?
No, I haven't yet, but I have to have you fill out the form. I didn't get back. You know what I mean?
I filled something out. But I don't
Maybe it just didn't
else.
get attached.
Yeah.
So
Um,
that's all right.
How do
That's
I-
no hurry.
okay. Do me a favor here. Help me figure out how I can get this big here again. How come it's down low?
No, not share, not files. Share camera. Yep, go to that share box.
Okay. This video is working.
Go to the share box.
This one.
Nope, one over.
There.
And then camera. Pick your camera. And then remember it takes a second. It must be the other camera.
Let me turn on. It says share video.
But do the share camera again. It must be the other camera. FD. There it is. There.
Hi guys. I am getting my camera set up here for you so you can see better. How's the video on your end? Good? Can you see it well? Okay. I'm just looking at this kidney protocol here. Or these kidney images here. Okay, so when you are going to pick a case for your kidney practical here, do you guys have your practical sheets with you? Yes. Good, 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 good. Okay. Because it looks like, I know in the past, we did an MRA renals underneath the Owens abdomen liver here. Now, there is a case that is a kidney one here that we could possibly use as well. And that's where I was just wanting to check. But we'll do the Owens abdomen liver because they actually have a renal part there. Okay, yep, let me go ahead and turn on record here. Okay, so underneath the abdomen hospital protocols, you'll notice that we do have a adrenals and a kidney protocol. Up here is also an MRA renals. So we're going to first drag over the adrenals and the kidney, okay? And then once we get to doing the renal pulse sequences, we can go ahead and open that up and we can pull whatever we want over as well, okay? So again, I want you to understand, this is a blended protocol where I'm showing you how to set up for some adrenals, I'm showing you how to set up for some kidneys, and then we're also throwing in how to set up for an MRA of the renals. And so what I want you to understand is, in the real world, you will probably be doing just an MRA of the renals or just the MRI kidneys, maybe just an MRI adrenals. So, you know, instead of breaking this all up into 3 separate practical sheets here, we kind of blended this all into one. And even though it looks long, there's just steps to follow that it's really not that long of a protocol, okay? So our first survey is going to be a breath hold. We're going to have to make sure that our proper coil is on, and we're going to use the XL, Torso XL Sense. And we're going to make sure that all of the coils are turned on, okay, all of the elements. Where I'm going to proceed, and I want to go ahead and take this on expiration. So we're going to say take a breath in, blow your breath out, and hold it. And I'm going to start the scan. You can breathe. I'm going to load in my 3-plane pilot. Let's go back and I'll have to delete that other one out because that had the wrong date on it. So we'll just go ahead and pull over. Let me get my little delete this out of here. Go back to my adrenals and kidneys. Okay, so we did the first survey, and my 3-plane pilot will pop up. Okay, our second survey is going to be with that navigator box again. Okay, just like we did for the liver. And basically, I'm going to go ahead and change. I can move these here. I'm going to go ahead and put my navigator box. If I bring it over here again, remember, notice I can now also see it on my sagittal to look at that dome there. And then I can bring it over and slide it 2/3 into the liver, 1/3 into the lung field. So for my next 3-plane, I want to make sure that I get an axial going right through the kidneys, right? Because we are scanning kidneys. I then can make sure my coronal's through the kidneys down here. And as far as your sagittal, let's go ahead and just put the sagittal right over. If I move this to the side, this is your descending aorta, okay? Because we're going to use that when we're going to set up for our MRA of our renals. Now this is a navigator, so it's going to go ahead and take about 33 seconds, so it's not that long, and it's going to take it with them breathing, so you don't have to have them hold their breath. Here is our reference scan. Yes, Shalika?
I'm sorry, I'm trying to write this down, but can you say that one time? You said a sagittal
Over the descending aorta. Okay, so then this is just going to be our calibration scan. And again, we're going to have them take a breath in, blow their breath out, and hold it. You can breathe. Okay, so our very number 3 is to do a T2 coronal free breathing through the kidneys and the adrenals. So I can open this up. I can see where my kidneys are at. I'm going to bring those down. I want to do coronals just through the kidneys. Notice on my sagittal here, I don't really have a sagittal through the kidneys, but that's okay. I know it's going to be in this area. My field of view, I can go ahead and now hopefully we have our arms above the head. Head to foot, I can probably bring that down to 300. Right to left, let's say 375. And this would be a good field of view where I can get the kidneys in the very center. on the first and second survey. Well, the first survey is a breath hold. That second survey, when you're using the navigator box, the navigator is a respiratory trigger, so that is no breath hold. But when you do the calibration scan, then yes, you need a breath hold on that. And I'll tell you what, if you don't even want to do that, because I don't have that listed on our practical, we can skip that calibration scan. That would be fine. We can go right into number 3 on our practical sheet where we are setting up the coronals. The calibration scan is the same as a reference scan, yes. So we can skip that. If that's confusing, just skip that. We'll just do number 1 as a breath hold, number 2 as a navigator breath hold, and now we're setting up number 3. So our slice thickness and our gap, we have a slice thickness of 3, and we have a gap of, bring it down here, user defined here, it says a gap of 1. And I'm going to open up our book to where it says MRI kidneys here. And you can kind of see what our book utilizes for kidneys. If we're doing adrenals, many times our adrenal slice thickness will be a little bit thinner than the kidneys is. And looks like for the adrenals on the coronals, they have 5 millimeter thick. Yes, Shalika?
I'm sorry, but I'm kind of confused here.
What do you?
It says kidney/adrenals.
Right.
So is it 2 different scans?
No, we're gonna go ahead. This is a coronal. So if you think about it, we're gonna actually, can you see my field of view? We're gonna be able to pick up kidneys and adrenals on this.
Okay.
What I'm looking for, I'm trying to go by what your book is telling you in case you have your book opened up. And I do not see just a specific kidney one. Okay. Oh yes, there is. Here's the kidneys. So they have 5 millimeter thick for both. For both adrenals on the coronal plane, for both adrenals, they have 5 millimeters thick. So if we want to change this to 5 millimeter thick, your number of slices for these coronal images, we truly only need to kind of get through the kidney area. Now, if some sites say that they include the entire 5 at what? Just do 5 at 1. You can do 5 at 1, or you can even do 5 at user defined. You can even do 5 at default. Either one's totally fine. We're only talking a half of a millimeter difference. Some places might actually do the entire coronal and then get the entire liver. But for me, you can go ahead and just concentrate over the coronal. So we can go ahead and bring these slices down to probably 20 slices. And I know I can page through a couple of my axials here that I am plenty anterior, that I will get all of my kidneys on. I am to the very back of the muscles in the lumbar spine area, so I know I will get all of my kidneys on these images. Okay? So I have 20 slices, 5 millimeters thick, at, you can do default or a 1 gap. Now this is a T2 weighted image. So I have to look here and say I have 400 TR, 410 TR at 880 TE. So I need to make this T280. So I'm going to go ahead and change this down to a range or user defined here, and I want this to be probably over 2500 here. I want my TE is at 80, okay? And can I find my little navigator box? And as I page through my coronals, my navigator box pops up. So I'm going to go ahead and just place that again where I need to. 2/3 into the liver, 1/3 into the lung field, like so. It's going to be 3 minutes long. Yes, you can keep this TSE at 64 because I'm thinking if we go down to 24, that's going to jump it to 9-minute scan. So we're going to let this at a 64 turbo factor here. Okay. So this should give you a good T2 weighted image. It's free breathing, it's 3 minutes, and I can just tell my patient, okay, Cindy, this is going to take 3 minutes, so just breathe normally. And I'm going to start it. I can, in this viewport, I can load in that coronal. Okay, so here is my nice T2 coronal, and I'm going to go to where my kidneys are located. Okay. And if I show you this image here, and I don't know if you can see it on the screen or not, but you'll be able to see it in lab. Right above each of these kidneys, you can see that little upside down Y. Those are your adrenal glands. Okay? So number 2 is an in and out of phase, axial image, and we want to make sure we get from the adrenals all the way through the kidneys. So first of all, I know I need to get a different field of view here. And you can use these same field of views that you used for your liver protocol here. So right to left, I'm going to go probably 375. We got a 250. I think we might even done a 300. Because again, so with some of these breath holds, when you're using sense, and we have sense turned on here, we use parallel imaging. You want to make sure you get a little bit of air around your anatomy here. So for our axials of the kidneys here, and of the adrenals, I'm going to pull up again to see what our book is telling us for our slice thickness. In the axials, they have 5 millimeter at, you can use a default again. So we'll go to 5 millimeter thick. We can keep it at user defined at 1, or I can do a default, which would be a 0.5. Okay? Notice it does have rest slabs built in here. And so with 25 slices, I might add about 2 more slices here because I want to make sure that I get above my adrenal glands and all the way through my kidneys. So I'm going to kind of page through just to make sure I am not cutting any of those. Now notice here how I'm really at the edge here, so I might even add a couple more. Maybe I'll go to 29 here. And just make sure I get the entire lower lobe of the kidney. And I know I have all of my adrenals on, which is here and here. Okay? This is going to be a breath hold. It is 25 seconds. Actually, it's done in 2 packages, so it's 12 seconds each. I'm not going to change any of the TRs. This is actually a dual field echo. If I look at my contrast, notice I have my 2 TE values here. Okay. So what I can do is proceed. And I can go ahead and tell my patient, okay, Cindy, this is going to take 2 times of holding your breath. Now, if you feel that your patient can hold their breath for 25 seconds, which is actually pretty long, you could just scan this back to back and just have them hold it for 1 series, but you're just going to have to hit start again. Or you can tell your patient, we're going to do this in 2 separate, 2 separate breath holds. Cindy, I need you to take a breath in, blow your breath out and hold it. Breathe. And again, take a breath in, blow your breath out and hold it. Start it again. You can breathe. That will give you your in and out of phase. Okay? Now, I actually have in here that you can pull up series number 7 in your viewing. So if I go to series number 7, here, this is where I want you to locate the in and out of phase, and this is exactly what we are doing in the last protocol. So you know that these are your out of phase, right? Because of that black line. And I know just by looking, if I page through here, just by looking at these, I know that these are my in phase. And my goal is that you look at these images and you realize that this is the signal of both fat and water. Up here, this is the signal of just water and no fat. The out of phase is when fat and water are out of phase, when you get that black line, and then at the very bottom, when you only see fat, this is my fat only one. Okay, so all you have to do is recognize those to me. Okay, go back, put my coronal, put my kidneys back up here. Okay. So what we have taken now is we've done a T2 coronal free breathing, which was number 3, and we've done an in and out of phase axial through the kidneys and the adrenals, which is number 4. What I'm going to ask you to do next, instead of to continue on and finish this protocol of the kidneys, we're going to go ahead and open up our renal protocol, and I'm asking you just to pull this bottom one over, okay? Because what we are going to do is we're going to set this up to do a quick renal, okay? So I'm going to open this up. I'm going to take this. Notice that my field of view is here, okay? And you could even bring this field of view down if you like. It's at 430, so we can probably bring this down to 375 on this particular patient here. I just want to make sure that as I page through here, okay, I'm going to be able to see, this is my heart up here, and I want to make sure that I can see contrast coming down my descending aorta right through here, because I want to be able to catch those renal arteries. Okay, I'm going to look at my axial slice here and page through where I can see. Oh, I'm going to pull up a better axial here because we did a better axial, which is our T2. Okay. So as I page through and I'm looking at my kidneys here, I can see my aorta in my inferior vena cava here. My aorta, when I see the branch that comes right anterior, right off of that aorta, I know that is my superior mesenteric artery. Go back through here. Okay. So I know that as I'm paging through and I'm looking at this vessel here, I'm going to bring this up, and I know that if I can get all of the kidneys on, and I have my aorta here, and I know that my vessels are going to go to the right side and to the left side, I know that I will catch my aorta coming down into my renals. And I'm going to turn off these slices so you can see within it there. So for my sagittal, I'm going to go ahead and just see. I can see off of my sagittal localizer, and that's why it's, yeah, you can't see the sagittal. Thank you. There we go. So off of this sagittal localizer, that's why it was important at the very beginning to get a nice sagittal right through your aorta. So when you look over here, I know whether or not I need to angle this coronal slab or not. Because sometimes you do want to angle it. Whoops. Because as your aorta comes down, it might kind of start to angle forward because of the curvature of your spine. Okay? So I'm just going to put a very slight angle there, because I can kind of see the shadow of it coming down here. And I know I'm going to catch those renal arteries. Now, one thing nice about this type of a protocol is I'm going to go ahead and click proceed. Okay? I can double click my bolus track here. And I'm just going to take this bolus track and put it right over the aorta, right here in the center of this axial. Okay? And what's going to happen with that then is, as soon as the contrast is going into the antecubital vein and then going to the lung field and then going in through the heart and then through the aortic arch and down into the aorta, it's going to take probably about that 20 seconds. If I look at this bolus track here, and this is a what we call this fluoral triggering. This is actually what happens live. And because this is a simulator, it's so hard to show you this because we're not live. But you can see that contrast coming in. And you can see it go into the lung field, and it's just starting to hit the arch, which was the very last picture before it goes back to running again, because this just keeps running like frontward to backward here. But look at this particular, I'm hovering over it here. I want you to look at this in lab, in your open labs. And once it hits the arch, that's when I'm going to be asking you to start your scan. Okay? So we're just going to position this right over the aorta. I'm going to click proceed. Now, once I open the 3D renal here, it's going to save what I just set up. So I want this first pre to match the post, because we are going to actually subtract these two in real life. Okay? So this protocol is actually kind of all set up together as one. Does that make sense to you guys? Okay, Shalika, yes.
So are you trying to say
Well, we are going to go ahead and have the patient hold their breath for the without. Okay? So what I guess, let me retrace things. I'm going to have you set up. Yes, Chelsea.
So the without is number 5.
Number 5 is just pulling over the sequence.
Okay, so the one that you're talking about now, is that the
That's
protocol
number 6.
that you, okay, then that's the one that you pulled over from the other one?
From number 5. Yep, and I can show you here on the screen. All that is, it was underneath MRA renals. So I only opened it and I just pulled it on over.
Okay.
And you're going to set up all 3 of these the exact same way. Okay? So if you want to go ahead and set these up all identical, all 3 of these, that's totally fine. But here's what I'm going to show you. So once I click proceed and I have all of this set up the way I want it, right? So it's going to start with my 3D renal without. And I'm going to say, okay, Cindy, this set here, and I forgot to look at the time. It says it's 38 seconds because it's done as the without and with. So in essence, this is going to be half. So it's going to be what? 18 seconds here, approximately 18 and a half here, 19 seconds. So what I'm going to say then is, Cindy, I'm going to have you hold your breath for this next set, and I'm not giving any contrast yet. So I'm going to say take a breath in, blow your breath out and hold it. You can breathe. And then in order for you to see, if I click on this bolus track, that's the only way I can pull up this live picture. Okay? But what I'm really doing is now my contrast. So I'm just going to click on this, and I'll be honest with you, I know this is difficult to understand, so I will help you with this in your practical somewhat, you know, I mean, because I know I'll like say, let's pull up that bolus track so we can see our pleural triggering here. Okay? But what we're going to do now is inject. So then what we're going to do is we're going to tell Cindy, okay, Cindy, you're going to feel that contrast go in now because this is with a power injector. So we're going to have, you know, pretend that we have her hooked up to a power injector. And I'm going to start the injection. Now notice, I'm not starting my scan. I'm starting my injection. I'm going to watch as the contrast goes in on this particular patient. And once I see the contrast hit the arch, which will be, and you can see this better in live when you're here in lab, which is going to be, and I wish I could stop this, but I can't. But once I see it hit the arch, which is now, I'm going to say, take a breath in, blow your breath out and hold it. And I'm going to start it. As that contrast is going down the ascending, not ascending, the descending aorta, I'm taking now my pictures. So as it's going through the renal arteries, I'm now filling K-space. And then just say breathe. Yes, Todd?
I can't see which scan you're doing. What scan are you doing?
We are doing the 3D renal. Let me see if I can blow it up for you.
There you go. We can't see the bottom of your screen.
Yeah.
There you go.
We are doing this protocol here, where it's the 3D renal, a 2D bolus track, and then another 3D renal. And all of this is, when you look at it, when you're trying to drag it over, notice how it's kind of got one big box, right? Because in the real world, this is, whoa, sorry about that. I'm trying to look at the screen without looking at my hand. Notice how this is all one big box. And that's because we set this all up even before we start having them hold their breath. We get it all ready. So we're going to pull that over, okay? Now I'm going to delete that because now I have two of them here. And then we're just going to set up for our without. Here's our bolus track. And here's our with. And they're all set up identically. Okay? The trick is, and probably the most important aspect of this is that you're understanding what you are attempting to scan. Because the very first thing that we're gonna scan is our withouts. And then, which is what we call a mask image. I'm trying to get this, you can see this better here. So we're going to do a without. We're going to let that bolus track sense when contrast is going into the descending aorta. The computer will then tell us that, we'll get a pop-up screen. And in the real world, the pop-up screen will say, start it, like begin to hold the breath. Then we can go ahead and say, okay, I need you to take a breath in, blow it out, and hold it. And then we're going to start it. Shalika.
Okay, so with those three, they're all set up. We set that up all at once, right? Because they're all the same.
Correct.
It's just the breath holding and releasing is what make it three different scans, right?
Correct. Right.
Okay.
And in essence, it's really only two scans. Because we're going to do a without. The middle part here, let me show you here, where it says this 2D bolus track, that's really not a scan. All that is it's, you know, we can put a tracker pulse over the aorta, a descending aorta here, and then the computer can tell us that it hit that spot, or some sites will do and have a fluoral triggering where it's another pop-up that happens where you just watch it. And then as that, you're going to start your injection, and as you see contrast hit the aortic arch, then you're going to say, okay, I need you to take a breath in, blow it out, and hold it, and start it. Does that make sense to you guys? It's going to take some time. I know it's just going to take some practice. Again, it's just that practice of breath holding and understanding what you are scanning. So, in essence, we've just ran with really one extra series here. We just did now an MRA of the renals. And this would be our contrast enhanced MRA of the renals. Okay? Number 8 is when we're going to go back to scanning the kidneys again. And I'm just going to go ahead and set up for an axial of the kidneys, and we can use the exact same fields of view that we were using, which was, I think, a 375, 300. I think some of you might even did a little bit smaller. Was it a 250? Either one's fine, and I do have air around here yet, right? This is a 3D volume, and we'll include the liver here. And if I page through, I'm going to look through my T2s here. Okay. So we'll get as much of the liver on here as we can. And I've gotten all my kidneys on. I got my adrenals for sure on here, okay? You do not have to change anything in your protocol. If anything, you can change your field of view, but everything else is set for you. So what I'm asking you then is, what 4 images will this give you? Scan 8. We are on scan 8. Yes, this is our pre-Dixon. So see where it says pre-Dixon here. Can you see that on your screen? Yeah, I think you can. So this is my without. So this is considered my T1 weighted scan, my T1 fat sat scan, my in phase and out of phase scan. So we're going to get 4 sets of images by this one breath hold, which is only 15 seconds. Okay, so when I ask you, it says, what 4 images will this give you? I want you to say it's a T1, it's a T1 fat sat, it's an in phase and an out of phase. And the reason it's a T1 fat sat is because remember as we looked through and we had the water only image, well that's technically a T1 fat sat because fat is taken out of the picture. Okay, so we're going to do my first breath hold here of 15 seconds. Okay, Cindy, I need you to take a breath in, blow it out and hold it. And we'll start it. You can breathe. We're not going to do the bolus track here. We're going to skip over that. We're going to then just set up this set to be identical. And again, I think I just had a 250 field of view here. It's the only thing I'm really needing to change. Okay. So then we can click proceed, and then what I'm going to have you do is we're going to do a 30-second, a 60-second, and a 90-second. This is what would be considered a dynamic scan, which we take the exact same pictures just in different timing increments. So we are going to pretend that we're injecting that patient again, even though we did it for the renals in number 7, we're just going to pretend that we're going to inject again. So we're going to go ahead and I'll just have something here that we'll pretend we're injecting. I'll have my phone here, so then we want to start scanning at 30 seconds. So therefore, once it hits 25 seconds, I'm going to say, okay, take a breath in, blow it out and hold it, start my scan. You can breathe. All you have to do on this one is to click on the 60-second, and we're ready for that one. And then we're going to watch the little timer, and once it hits about 55 seconds, because again, I want to start scanning and collecting my signal at 60 seconds. So you need to give them about 5 seconds. Take a breath in, blow it out, and hold it. Breathe. Now we're going to do the 90-second. And again, take a breath in, blow it out, and hold it again. So we're going to go ahead, and again, this is all one protocol. So once I set up number 1, then 30, 60, and 90 are all set up identically. Again, it's just understanding that this is how dynamic scanning is done. Okay? Does this make sense? Am I confusing anybody? I'm trying to take it slow, but yet keep moving. What do you guys think? And I think once you sit down and you actually get on the computer and you do this yourself, I think it's going to start to get it. Good, 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 yes. Because like I said, you know, these abdominal protocols and this contrast enhanced renal protocol. It's done with a power injector. You know, we are injecting from behind the computer here. We're not in the room. We're not taking the patient out of the scanner to inject. They're in there. They are hooked up to their IV, to the power injector, and we are starting the injection back here, and then we're telling them when we need to hold their breath, depending on where that contrast, you know, is at. If we're doing renals, we're going to have them hold their breath when the contrast hits the aortic arch. If you're doing a M. Dixon technique and you're doing a dynamic aspect, we're going to scan them at 30 seconds, at 60 seconds, and at 90 seconds. Because what radiologist wants to see is the uptake of contrast in the arterial phase, in the portal venous phase, and then more at a later phase after that. So basically, as contrast is going through the aortic system, aorta, into the kidneys, and then as it's coming back up through the IVC into the kidneys, and then into the portal venous system, into the liver, and then on out back to the lung field. That's kind of what we call dynamic scanning. It's done in a certain timing interval. Okay? What I also want you guys to practice is how to reconstruct an MRA of the abdomen. And I'm going to show that quickly here. We only got about maybe 5-6 minutes left. But if I click on up here, I'm going to try to show it to you closer here. So if I click on the pumpkin, it's going to go ahead and load all of these series that I just took. Okay? And what I need to pick here is I need to go ahead and, okay. First of all, I'm sorry, I have to pick a different, I'm going to close out of here. So what I need to pull up is a renal case. Let me pull this back down here so I have to hold it. Okay. So there is an MRA renal case. There should be anyway, unless it was deleted on here. We might have lost this case from Owens. And I think we did. Okay, the whole very bottom part on the computer here, don't worry about it. Or on the practical sheet, don't worry about, because this contrast enhanced MRA of the aorta and renals is no longer on our software. When they downloaded it and loaded all of our cases back up. Yep, number 10, don't worry about it. Take a big old X and cross that off. So all you need to worry about for your practical here is 1 through 9. Okay? If I can find this case in one of our flash drives and can re-upload it, I'll show you what I wanted you to do just so you can see it, but it won't be part of your practical. Okay? So what do you guys think? Any questions? Again, you know, number 3 is a T2 coronal free breathing. And we did that already last week. So we know how to do that. We know how to set up an in phase and out of phase. what I want you to understand, and the whole part of this protocol is to understand what happens when we're doing renals and what happens when we do an M. Dixon. Because those are terminologies that you're going to hear out in the field. And to understand, well, what is this 30-second, 60-second, 90-second type of thing? Some places might do a 20-second, a 60-second, and maybe a 2-minute, because what they are wanting to visualize is the flow of contrast going in and out of a structure. And what radiologists can do on their computers after the fact is that kind of what we talked about with breast imaging is they can create kinetic curves, and they can see within a certain tissue how contrast reacted and went through that tissue in and out over a certain timing interval. Okay, so that's what is the most important part of this protocol, is understanding what you're doing and understanding why you're doing it. What is this timing thing? Because unfortunately, if you do this wrong in the real world, you just can't inject again because it's a one-shot deal. The contrast is already in your patient. Your timing, you missed it. You can't scan it again. So what happens is you have to let that patient go and say, you know what, I need to go ahead and have you come back maybe a day later, 2 days later. You can't do it right away that day because contrast is still going to be in their system. Then you're going to have to repeat it and then make sure that second time they come in that you get this timing down the right way. So I think that's what I really want to enforce through this practical, is that you understand the importance of timing. It's crucial that you set these up at the right. Setup is actually easy, is that you start your scan when you want to start your scan at the right time.